the two speakers that we're going to have to talk about science are Dr. Yu-Chin Lin and Dr. Jagadish Puvula. And so both of them have worked on several projects, but this project that they're going to talk about is related to how extreme heat can affect the placenta, which we know is a critically important organ for fetal development. So I think you, Chin, you're going first, is that right? Or is it Jagadish?
Uh, it doesn't matter if
Okay.
I can go first if you want me to.
Sure. So Yu Chin is a research assistant professor here at Penn, and has done a lot of work on mitochondria and mitochondrial function and epigenetics in placenta. And so she's going to talk about her research first. So, and then if you all have questions, just put them in the chat, and then we will answer them at after each talk.
Okay. I need to be able to share my screen. Can someone let me share my screen?
Just to prove that you should be set.
Okay, so share. So can you see my screen?
Perfect.
Perfect. Okay, great. So good morning, everyone. Today I would like to share with you our studies of air pollutants and spontaneous preterm birth. So I know in this seminar, we aim to discuss the impact of extreme weather on children's health. So why do I want to talk about the air pollutants? In fact, the climate change and air pollutants are interconnected, where one can exacerbate the other. So changes in climate, like warmer weather, and altered weather pattern can lead to increase the ground ozone level and worsening existing air pollution. And conversely, some air pollutants like black carbon or ozone, they are also cold, short-lived climate pollutants, and that can contribute to climate changes. So there are two types of air pollution. Gases such like ozone and sulfur dioxide, and particles including black carbon, mineral dust, and liquid particles. And these particle pollutants are called particulate matter, PM. The PM is usually grouped by their size. The two major size classes are PM10 and PM2.5. In here, you can see that a human hair has an average diameter of 70 micrometer, and PM10 and PM2.5 pollutants are much smaller than hair, with diameters of 10 and 2.5 micrometer. And PM2.5 pollutants get a lot of attention in these days because they are so tiny and they can easily travel in the body and cause injury. So should we concern about air pollution in our community? This is the ranking of average PM2.5 exposure in the United States between 2020 to 2023. You can see that Pennsylvania ranks number 7 among all states. And in terms of cities, Philadelphia is among the top 10 cities with most PM2.5 exposure in 2023, even higher than New York City. So it has also been shown that the black carbon can be detected in both maternal blood, showing in the blue color here, and cord blood, showing in the red color here. And a higher black carbon exposure is associated with the higher black carbon levels in blood. And this black carbon can reach the fetus and accumulate in fetal tissues such as fetal liver, lung, brain, and placentas. And in this figure, you can see that black carbon levels are higher in placenta compared to other fetal tissues. And the level of black carbon exposure are also associated with the black carbon levels in the placenta. So placenta is a temporary fetal organ that developed in the uterus during pregnancy to support the baby growth. Placenta is metabolically active and can facilitate nutrient transport and gas exchange. It can also protect the fetus against infection, toxin, xenobiotics, molecules, and maternal diseases. Placenta also produce and release hormone to regulate uterine functions, maternal metabolism, and fetal growth and development. Placenta dysfunction can lead to adverse pregnancy outcomes such as preterm birth, preeclampsia, and poor baby growth. So preterm birth is baby delivered before 37 weeks of gestation. The report from March Dye show that the preterm birth rate in the United States is about 10.4% in 2023 and get a rating of D+. And in the preterm birth rate in Pennsylvania is 9.7%, slightly better than the average in the United States. However, the preterm birth rate in Philadelphia is higher than the average rate in Pennsylvania. It's about 11.2% and rated as D-. So spontaneous preterm birth accounts for about 70 to 80% of all preterm births. The remainder are medically indicated preterm births, primarily due to the preeclampsia. And the underlying mechanism causing a spontaneous preterm birth is still not well understood. However, placenta dysfunction can contribute to spontaneous preterm birth. In our lab, we have used multi-omics approaches to investigate the role of placenta dysfunction in spontaneous preterm birth. We conducted metabolomic studies. It is a large-scale study of metabolites in placenta, and transcriptomic study to investigate the gene expression changes in preterm placenta. So we found that multiple metabolic pathways are altered in spontaneous preterm birth placenta, particularly lipid metabolism such as long-chain fatty acid and acylcarnitines, and metabolisms for branched-chain amino acids, polyamines, and oxidative stress metabolites are also altered in spontaneous preterm placenta. We also found that genes regulating energy metabolism, mitochondrial function, peroxisome function, oxidative stress, inflammation, and detoxification are also altered in preterm placenta. And all of these changes can lead to placenta dysfunction and inflammation, leading to the preterm birth. So since air pollutants such as black carbon can accumulate in the placenta, so is there any association of air pollution and spontaneous preterm birth? So in order to answer this question, we collaborated with Jagadish to investigate whether exposure to PM2.5 and black carbon in early gestation, about the first 20 weeks of gestation, is associated with the spontaneous preterm birth and the changes in the gene and metabolism observed in the preterm placenta. We selected a subset of 73 patients from our previous study. About 47% of patients experienced spontaneous preterm birth with delivery before 32 weeks of gestation. And majority of them resided in or near Philadelphia metro area and delivered the baby between January 2017 to February 2018. And we can access patients' information through the electronic health record. And patients with fetal abnormalities, intrauterine growth restriction, infection or pregnancy complications such as diabetes, gestational diabetes, hypertension, or preeclampsia were excluded in our study. Our daily air pollutant exposure data is in a 1 kilometer resolution range, and they are linked with maternal residential address at delivery. Our analysis including 3 steps. The first step is to investigate the association between air pollutants and spontaneous preterm birth with logistic regression analysis. And we use the numbers of days in each month with the patient exposure to PM2.5 above 9 microgram per meter square, or black carbon above 1 microgram per meter square in our analysis. And step 2, we evaluated the association between the air pollutants and the level of the genes and metabolites in placenta. And the last step, we use high-dimensional mediation analysis to investigate if any changes in genes or metabolite associated with air pollution exposure can contribute to spontaneous preterm birth. So if you have any question about the statistic analysis, please reach out to Jagadish. He is the expert in this analysis. So we first investigate association between the air pollutants and the spontaneous preterm birth. So this table shows you the odds ratio of spontaneous preterm birth associated with PM2.5 or black carbon exposure. From our data, we didn't see a clear association of PM2.5 exposure with spontaneous preterm birth. However, we found that the odds ratio are higher for the black carbon exposure in months 3rd to 5th during pregnancy, and the black carbon exposure were higher among women delivered preterm. We next evaluated the association of air pollutant exposure with the level of gene expression. We found that the level of 100 spontaneous preterm birth associated genes are associated with PM2.5 or black carbon exposure. And these are some examples. The left-hand side is black carbon exposure, and the right-hand side is the PM2.5 exposure. You can see that there are more genes associated with the black carbon exposure compared with the PM2.5 exposure, especially during the 3rd to 5th months of pregnancy. The expression of gene that can be induced by air pollutants as indicated by the red color, or can be inhibited by air pollutant as indicated by the blue color. We also found that the level of multiple metabolites are associated with air pollutant exposure, particularly there are multiple lipid metabolites. In our previous study, we found that the lipid metabolism is the most significant metabolic pathway that are altered in placenta from spontaneous preterm birth. Since we found more association of black carbon exposure with spontaneous preterm birth, we then conducted a high-dimensional mediation analysis for black carbon. We found that black carbon exposure in 3rd or 4th months of gestation increased the risk of spontaneous preterm birth. And the differential expression of multiple genes associated with black carbon exposure may contribute to the spontaneous preterm birth, including the myeloperoxidase, elastase, and gonadotropin-releasing hormone. So in summary, we found that the exposure to black carbon between 3rd to 5th months of pregnancy is associated with about 15 to 25% increase in odds of spontaneous preterm birth. And gestational exposure to ambient particulate matter is associated with the differential expression of spontaneous preterm birth associated genes, or the changes in placental metabolites involved in the lipid, amino acid, nucleotide, and xenobiotic metabolism. And black carbon exposure during the 3rd and 4th months of the gestation is associated with the differential expression of multiple genes in the placenta, which may contribute to the spontaneous preterm birth. So in the next step, we will look into more details of the biological function of these genes and metabolites whose level are associated with the air pollution exposure, and to elucidate how air pollution can affect the placenta function leading to the spontaneous preterm birth. So I also collaborated with Jagadish for another project. We wanted to investigate the impact of heat wave on placenta metabolism. We have conducted a metabolomic study in healthy term placenta from 200 individuals. We included the Black and white women with both male and female offspring in our study. And we have identified 922 metabolites in 122 metabolic pathways in our study. And Jagadish is currently integrating the climate data and metabolomics data. So although these placenta are from healthy babies at birth, the changes in placenta metabolism may affect fetal development and predispose them to certain diseases later in life, such as obesity or diabetes. So stay tuned for our study. So at last, I'd like to thank all the members in our PAN March of Dimes Prematurity Research Center, especially Becky for her long-term support, and our collaborator, Aimin and Jagadish, especially Jagadish, who conduct all the statistic analysis, and our bioinformatics support from Blanca and Mongyuan. And of course, our funding source from March of Dimes, NIEHS, and our Children's Center. So thank you for your listening, and I'm happy to take any questions.
Thanks, Yu-Chen. It's great to see how far this project has come along.
Thanks.
Don't see any questions in the chat. And maybe I don't see any hands up either. So we'll move on. And so then maybe as people are thinking of their questions, they may ask them afterwards. So Jagadish, would you like to? So Dr. Pavula is a postdoctoral fellow in Eamon Chan's lab. I hope I got that right. And Aman couldn't be here today.
I'm here. I'm here.
You are there. Oh, well, you should
I was 3 minutes
introduce
late. Sorry
him.
about that. Yeah, I
Okay.
had another meeting.
You can introduce him much better than I can.
No worry. Yeah, Jagadish is currently an instructor in the Department of Biostat Epidemiology and Informatics, and he's working on multiple fronts, and particularly in this because he got a PhD in environmental health science. So actually, he can, in looking at the data in temperature and air pollution much more deep, look at geospatial exposures. And this project is from a pilot project he received from Children's Center, and he will examine the extreme heat and the pediatric environmental health risk.
Thanks, Simon. Today I'll talk about extreme heat and pediatric health risk in the US. And when I refer to health risk, what I mean is the framework that we adopted from the Intercontinental Panel for Climate Change, which basically says an overlap between population vulnerability and an exposure to climate-related hazard. In this case, we are using extreme heat. And our goal is to develop content for public health education and capacity building to minimize potential pediatric health risks that are attributable to extreme heat. So before I jump into temperature, here is a trend from 1990 to 2019 on how different sectors contribute to greenhouse gas emissions globally. And this is from the AR6 from the IPCC report, which got released in 2023, wherein we could see like the energy sector is contributing the most to the greenhouse gas emissions, and even the other sources such as industries, transportation, building, and construction are mostly linked with human activities. And also, I would like to introduce about radiative forcing, which means solar radiation comes in and some part is reflected and some is absorbed by green space and blue space. And due to the greenhouse gas emissions, due to human activities, some of them get trapped in the atmosphere. And also some radiation, infrared radiation emitted by the Earth's surface gets also reflected, which is likely to increase the global temperatures. And here is the global annual temperature anomaly starting from 1850 until 2025. I adopted this again from the NOAA, which is basically comparing if there is any monthly average of temperature that is high or low when compared with the monthly average between the historic normal, not the historic normal, average from years 1901 to 2000. And since the second industrial revolution, which is around like 1980s, we could see like a increase in temperature anomalies towards like the hotter end. And this is a plot of showing how the temperature anomalies would look like at different greenhouse gas emission scenarios. SSP 1 to 5, which are like shade socioeconomic pathways, and 1.9 to 8.5 are referring to the radiative forcing in terms of watts per square meter. And in this study, we are particularly interested in 4.5 and 8.5 because 4.5 is almost close to where we are at this moment. And 8.5 is to show like, if it gets worse, what could happen. And the numbers beside these scenarios are number of global climate models that are being used to generate these trajectories over time. And here we could clearly see the orange of the SSP 2, which is like 4.5 radiative forcing, is much lower than the SSP 8.5. And to build context between extreme heat and its relevance to human health, in the US, there are up to 12,000 deaths, 67,000 emergency department visits, and about 9,000 hospitalizations per year that were linked to extreme heat. And our goal to emphasize on children is because of their physical and behavioral characteristics that makes them more vulnerable. One is smaller body to mass surface ratio, makes them a higher risk to get dehydrated. And children spend more time outside than adults, which is again increases the risk of exposure. And to conduct this study, we retrieve data from 3 different sources. One is US Census Bureau, where we retrieved about 10 socio-demographic factors that are relevant to children to develop a vulnerability index using high dimension reduction methods. We also retrieved climate normals for meteorological summer months, June, July, and August for the historical period between 1901 to year 2000. And this comes as like monthly gridded data of daily of temperature maximum at 4-kilometer resolution, observed temperature between 2012 to 2024. Again, this is limited to June, July, and August at 4-kilometer resolution. And we calculated the anomalies if there is any day between 2012 to 2024, only during the meteorological summer months that exceeded the historic normal. we counted that as an anomaly during the study period. And going to the future climate projections, we retrieved daily maximum temperature data from NASA Earth Exchange downscale climate projections, which comes with 30 distinct global climate model outputs at 25-kilometer resolution. We retrieved the data for 2 different greenhouse gas emission scenarios, which is SSP2 and SSP5, and for 2 different timeframes between 2041 to 2060 that we refer to as midterm, and 2081 to 2100, which is the long term. And for the future climate projection, since we do not have a reference temperature metric to count anomalies, we counted any day above 95 degrees Fahrenheit, sorry for the typo, as an anomaly. So when I mentioned monthly historic gridded climate normals, these are the data layers that we used as a reference to count anomalies during the study period between 2012 to 24. And the rationale of why we used a gridded normal instead of going with a static threshold is because, like, as you see here, the normal value of the temperature value, it is dynamic by geography and also changes by each month. So that is the reason, like, we adapted this approach to count anomalies during the study period. And here is a plot that shows the cumulative observed temperature anomalies during the study period, which is 2012 to 2024. And here, majority of the West Coast, Northwest, Southwest Texas, especially, and also Florida and parts of the Northeast have high number of anomalies compared with the other states in the US. And this plot shows, like, the pace of warming in wherein I used year as a predictor and count of anomalies as the outcome. And the intensity of the color red shows how fast the temperature is getting warm in these regions. And for this analysis, we did use each 4-kilometer pixel as individual level analysis and then compiled everything to show this in the map. And here we can see, like, especially in Texas, there are like several hotspots, and also in the Southwest and also in Florida, there are regions that are rapidly getting warmer. And here is a somewhat more detailed perspective of what I showed earlier in the map. I selected about 40 different cities to see what is happening in these particular cities. Only in Madison, I was able to see there is a weak cooling trend. And the top 2 cities wherein I observed the warming trend is rapid are Jackson, Mississippi and Baltimore. And when I show like beta of 1.64 is every year increase, the anomalies are increased by 1.6 days. And when it comes to Philadelphia, every 2-year increase, we could see an extra anomaly in Philadelphia. And here is the overall idea of why we created this project, is to overlap the hazard, which is extreme heat in our situation, and also add the pediatric vulnerability layer. And we are particularly interested in this last quadrant, which is the dark purple color, which highlights high hazard and high vulnerable areas. And from here, we could see like a majority of California is categorized as high risk and high vulnerability. And also Texas, we see like some areas, and also Florida and some parts of the East Coast. And going to temperature anomalies during the midterm, which is 2041 to 2060. On the left-hand side is when when we are referring to a lower emission scenario, and on the right is the higher emission scenario, wherein we could see like some space difference in terms of where the anomalies are higher. In the lower emission, we don't see much, especially in the southeast. But when we are going to the higher emission, we could observe like parts of Florida have higher number of anomalies, and also the area that we see in the central region is also getting more hot. And we overlap with the vulnerability layer. We did see like some areas again in California and Texas and some central states, but we didn't see like compelling trends comparing with lower emission to higher emission scenario. And this is like going to the long-term period, which is 2081 to 2100, wherein we observed again like the high anomalies are in the whole state of Texas, Oklahoma, and some parts of California and Florida and the Southeast. But in the long term, when we go to the higher emission scenario, you could see like a lot of area in the Southeast, Central, Southwest, Northwest, and West Coast are at showing like higher number of anomalies with maximum temperature. And similar to the near term, we didn't see like compelling trend when we overlap extreme temperature anomalies with the vulnerability layer. And yeah. And I would like to acknowledge my mentor, Aimin Chen, and the whole team who shared their inputs for me in working in this project. And again, like thanks to funding from the Children's Center. And I'm not sure if I should take questions now or save for later.
Just see if anyone have like burning questions.
Okay.
Yeah.
Armin, it's Trevor here. It's a great study. I wanted to understand what you meant by pediatric vulnerability. How do you define that?
So we used 10 different metrics that includes race, ethnicity, access to care, which means like access to a vehicle or health insurance, and different other metrics comes from the American Community Survey. And also financial vulnerabilities if the child is from a household that is under the poverty limit, or if they have language barriers. And there are like a set of 10 to 12 different metrics. We use principal component analysis to combine all these 10 as an indicator variable, and that is what I was referring to when I say pediatric vulnerability.
Okay, great. So there's no actual health outcomes being
No, we haven't used any health outcome. The whole project, I did use open source data.
Okay.
All right. If we don't have any questions, I think Becky, do you want to introduce Marilyn?
Hi, everybody. I think you know Marilyn. So, Marilyn, if you're ready.
Sure. Let's see if I can share my screen. Hi, everyone. Let's see. There we go. Hi, it's great to be with you and hear about the my co-presenters' great science. We in the Children's Center, as a translational center, take science from our center and other places and bring important information to people and policymakers and legislators so they can use it. And so in this effort, I'm going to talk today about a couple of types of things that we've done specifically around extreme weather, but I would send you to our website that actually has a lot more resources around mitigating extreme weather effects. In particular, a lot of our air pollution information is contained within prescriptions for prevention and other resources there. I could not do any of the work that I do without my program coordinator, Isabella Andriozzi, who is on the call today. And I'd like to thank her for all of her work in this and other programs that we do together. Some of the specific materials that were created today were done through our Extreme Weather Fellows, Margaret Ferrandino, Colin Battis, and Apsara Mitra, and their work was really critical. Dr. Puvula has shown you lots of maps already having to do with the increase in heat. And this one I thought was interesting. It shows the statistically significant temperature trends in the month of February, a month that we normally view in Philadelphia as being quite cold, and showing that even in February, we are seeing increasing temperatures over the last century. But I will also call your attention to how variable that is for areas around the country. And just as the heat on any particular month is variable around the country, so too is the experience in a neighborhood. And as we translate materials and problems and issues and solutions to people, we really need to think about it on a very small geographic level. And so in Philadelphia, we have what's called heat islands, these areas with limited green space, lots of buildings, lots of concrete. And this map, done not by us, but by the Office of Sustainability at the Philadelphia Department of Health, if you look at the darkest red areas, these are the census tracts with the highest temperatures and also ones with the greatest social vulnerability in Philadelphia. And as you can see, North Philadelphia, West Philadelphia, and even parts of South Philadelphia are considered these heat islands. So one of the ways that we can begin to address the lack of green space is to encourage people to plant trees. And in speaking with people, we learned there are a lot of misconceptions, bad feelings about trees, all kinds of reasons why people do not want to take this step. And so we developed a document for property owners, businesses, and associations, and gave them the rationale that trees actually cool your neighborhood, clean the air, and are a true energy savings. And the other items that are in this this brochure are the myths that people have that, you know, when they find tree roots in their water line, it's not because the roots broke the water line, it's that the roots went to the water, i.e. the already broken water line. The easy ways to get trees. How do I take care of them? Who will help me take care of them? And so we have brought all of these resources together. Where should I plant? What kind of tree shall I get? All of these things we hope we have in one place to make it easy for people who are beginning to think about wanting to have a tree. And we decided to take it a step further, recognizing that in particular, younger residents use social media. We developed a social media campaign. The first one was really starting with how multiple trees can be particularly helpful. Just one tree can shade nearby buildings and cool down a street noticeably, but planting multiple trees close to each other multiplies their cooling benefits, reducing the amount of heat and pavement of the pavement and the buildings absorb. And so other frames in this very short video show a block in the Hunting Park section of Philadelphia that is 10 degrees hotter often on some summer days. And we digitally inserted a number of trees and calculated how many kilowatts of electricity might be saved. And so this video makes this case. And these are very short videos that are intended to be shared on social media. Similarly, we created one on the air quality benefits of trees, the carbon storage benefits of trees, temperature reduction benefits, and flood reduction benefits. And so we believe, and some of these are in other neighborhoods. The flood ones I'll show you later in Eastwick. But I think the idea here is by focusing on a particular benefit, we may help to get over some of those barriers among Philadelphia residents. All of these videos can be found at this website. In addition to heat and air pollution, extreme weather includes precipitation. And here we can see precipitation anomalies in our region. Pennsylvania as a whole has seen increased precipitation. But increased precipitation alone is not the biggest problem. The biggest problem is how it's raining. These concentrated rain events lead to overflow of river banks like we saw during Hurricane Ida, flooding the Vine Street Expressway in 2021, and also in a neighborhood where people live, Eastwick, during Isaias in 2020. The key issues for residents in Eastwick is that this is a recurrent problem for them. They have recurrent flooding. They find it very difficult to predict. Each time the way their row homes are constructed, they have their utilities on the lowest level. Excuse me. So their heater, their water heater are frequently completely damaged and need to be replaced. These are big ticket items for middle class and working class families. And so the mental health impacts of these cumulative trauma, the emotional, financial accumulation is quite substantial. When we talked with them, they also told us about poorly coordinated information. They don't know where to take their car. They don't know where to evacuate to. They don't know when to leave, because there are frequent rain events that are not, they don't look to be that substantial, but when it's enough water upstream from them, they end up getting inundated. And so this information flow was a big problem that they identified needed to be solved. And then there's chemical contamination. We saw it in a very big way during Hurricane Harvey, where 13 hazardous waste sites were inundated around Houston, and people saw oil slicks all over the place in these floodwaters. Well, we in Philadelphia have the Philadelphia refinery, and although the refinery itself no longer has this massive infrastructure, that's all gone, the contaminated soil and groundwater is still there. It's contaminated with petrochemicals and lead and a number of other contaminants that have the opportunity to spread to neighbors in big flooding events. This is very low, the ground that the Philadelphia Energy Solutions was on. And I mentioned Eastwick. Eastwick is immediately adjacent to a landfill that is now remediated with a soil cover, but I would say still vulnerable to massive flooding and disruption of that cover. But it doesn't have to be as exotic as a Superfund site. It can be the oil and gasoline from vehicles or from just the roadways, and these chemicals are brought into people's homes. And the mold growth that happens after a major inundation that stays for several days is really quite substantial. So what we did, hearing folks' concerns about the lack of information, is we developed a flood preparation and management guide for Philadelphia, in particular focused on the Eastwick neighborhood, since that was one that we knew needed this immediately. It included some supplies. You'll see here a bucket and personal protective equipment, safer cleaning materials, and also what's not pictured is a material that you put at the under your door, and it expands with when it gets wet, so as to slow at least some water intrusion. We give information about preparing a go bag. These, by the way, are 10 double-sided laminated reference cards that are hooked onto the pail. How people can stay informed before floods, during rain events, knowing when rain events are happening. How they can use local resources to figure out whether or not they will be inundated. There is actually a USGS water alert on the Cobbs Creek. It is not particularly specific for Eastwick in that it really doesn't measure what's coming downstream. It measures what's there at any given moment, and it takes measurements every 30 minutes, probably not adequate for the community to know exactly when to evacuate, but it's better than nothing, and some people feel more comfortable being signed up, and so we give them information about how to sign up for that. How to lower their flood insurance premiums, because places that routinely flood have massive insurance costs, and so there are ways that allow people to lower that. How they prepare the inside of their house, how they prepare the outside of their house, cleaning storm drains and so forth. And then once a flood occurs, how do you prepare yourself? What precautions do you need to take so that you don't have health risks, or you can minimize your health risks to the contamination that you may find as you move in? So all of these materials are on our website, freely available. Some of them may need to be tailored to an individual community, but of course, feel free to do so. We also, in our communications with communities, in our focus groups, we recognized that there was a lot of background science knowledge that was lacking in terms of heat and the water cycle in general, and air quality and how it impacts health. And so we developed and curated curriculum that was specifically geared to Philadelphia around extreme weather topics. However, really had a lot of background resources and materials that could be used by anyone. And these were created for teachers. We put together the curriculum, we brought together the resources, put them on our website, and then we recorded presentations, webinars, also on our website, about the content and the materials on these three topics: excessive heat impacts on public health in Philadelphia, water impacts on public health in Philadelphia, and air quality impacts on public health in Philadelphia. And our strategy in creating these really was not only to reinforce the science background needed to understand the health impacts, but to use health and local environmental circumstances to make it relevant. We know that people hear a lot about flooding or about heat, but how does it impact us in Philadelphia? We really thought students and teachers would need that in order to have it resonate. We wanted to introduce students to resources that they could use outside the classroom and engage them in mitigation and adaptation type activities so that they were thinking positively about these, what they could do in their families and in their communities, and not just feel scared or worried about these circumstances. And so one of them that is probably was most extensively fleshed out by us is a journey through water's path and its challenges. And so part of the lesson looks like this. It includes objectives and standards that we linked it to in Pennsylvania, from the education department. The materials that one might need. It had background material broken out into a whole variety of lessons that walk students and teachers through how this might be presented, as well as a number of engaging activities that students could use. We used the internet whenever possible. We showed students and teachers how the combined sewer overflow system works, and how the Philadelphia Water Department has CSOcast, a place you can go and determine whether or not in the last 3 days raw sewage has been dumped into your local waterway, and why that matters to your health. What are the impacts of flooding? We use some case studies to have people understand how this may impact their health, and walked through some resilience and opportunities for green infrastructure to give examples that are here in Philadelphia that people use to try to make this better. So our goal in doing all of this work is really around connecting people to a better understanding of what is happening, what they can do about it, to reduce fear by enhancing environmental health literacy around these topics, and offering resources that they can use here and now. And so I'd like to thank you, and again, suggest that you follow us on social media, and also look at our website, where there are a whole lot of other resources